Hey, good morning, everybody. It's time again for Health Talks with Dr. Trinh. The one show, maybe the only show, that shows you how to live a healthier life and answer some of the questions and confusion that continue to swirl around so many health topics today. The man who's always swimming with info. You must be reading data. You're always inputting new studies. You're looking at stuff all the time that us mere mortals don't know how to read or find the time for. How do you handle this constant influx of data?
Oh, it's just untreated ADD.
That's how it is. Okay.
Pretty much. Yeah, untreated. Just don't treat me, and my head would run with 1,000 new ideas.
You do work with? Are you on? I forgot your connection with them. Are you on the
360 Clinic? I'm on their leadership team.
And 360 Clinic has been on here before talking about the
testing.
Look how far we have come. A year ago, we couldn't get a test. Now, much less a vaccination. That was forever. Right. That might be years in the future here. And then they got the vaccination and they started rolling out, and it was a mess. Sorry, Orange County, but it was a mess. And it was delayed, and you couldn't get through, and nobody could get it, and people were frightened. And then they started to work it out. I think it's pretty well on a pace, and now it's expanding. So 360 Clinic has expanded their offerings from not just testing when they were amongst the first. Now they're among the group vaccinating, right?
They're among the group vaccinating. Tomorrow you can find them at the Fountain Valley Sports Park, which is, I think, inside of Mile Square Park.
Somewhere, yeah. Somewhere in...
Yeah, so they're there tomorrow. They're there again, I believe, on Monday. And the way you would sign up, if you have friends and family who need vaccination, most of us have already heard that we have opened up vaccinations to really anyone above the age of 16, right? It was originally, above 65 and then above 50, but now it's pretty much open up to all adults.
So we're going to open up today's discussion for those who are still wondering, who are still worrying, where do I get it? How do I get it? Should I get it? All those kinds of, I don't know why we're still debating all this stuff here, but here we are. All right.
Let's bring on our folks, Chelsea and Terry's in the waiting room.
Terry's in the waiting room. Let's get them on here. Okay. Let's get that. Let's let them in on the waiting room. Sorry. While we're talking here. No, I just am amazed that we are still, I guess we're, welcome, Terry, she's connecting. I'm amazed how far we've come, and yet I'm amazed how far we haven't come in the public perception of all this. So welcome as they connect. We've got Terry. I'm gonna let Terry and Chelsea introduce themselves, starting with Terry. Welcome, Terry.
Hi.
So tell us your name again, and what you do, and why you're here, and all that stuff.
Okay, so my name is actually Terry Manali. I'm a nurse practitioner at 360 Clinic. I'm the CCO, the Chief Clinical Officer. We are here to...
She's saying, why am I here? Who booked me on this show? What am I talking here?
I actually don't know.
What the heck am I doing here? Yeah.
What the heck am I here for? We're just updating on what's going on with the...
Yeah.
And vaccinations. You guys have moved into vaccinations. Oh, my goodness. Thank goodness. We got more people doing vaccinations here. And then we've got Chelsea here, Chelsea Nguyen, or Nguyen, as Dr. Trinh likes to say here. He always mispronounces Vietnamese names here. I don't know why.
Okay.
That was good.
Not Nguyen.
Nguyen is the right way to say.
That's the way I learned a long time ago. I got slapped enough times. It's not Nguyen, but we had Dr. Trinh on some show, and he actually said Nguyen or something, and I'm like, Dr. Trinh, you're Vietnamese. That's how to spell it. All right. Anyway, so Chelsea, what do you do, and why are you here?
Hi, good morning, everybody. My name is Dr. Chelsea Nguyen. I'm a pharmacist. I'm the director of telehealth, and I also help run vaccination clinics here at 360.
So we got a lot to talk about this morning. Why? Let's celebrate the good news. Vaccinations are now available to everybody, right?
Yes.
That was not the case when this started, we didn't have a vaccine. We couldn't get testing for everybody. That seemed insurmountable. How did we get from I can't even get a test to now everybody can get a vaccine? How have we moved this far, this fast in a year? That seems pretty amazing. So I'll say to Chelsea, what do you say? Why how did we get this finally ramped up and revving here?
Well, I think it's definitely a team effort, not just in, our country, but all over the world. Is everybody was able to see that this is the priority, and we came together as a team, and we've said that since this is a priority, we have to figure out how we can do it so that we can vaccinate all of our people, so that we can go back to some type of normalcy.
Yeah, exactly. All right, so Dr. Trinh, there's 300, I think I just saw there's 390, 360, I forgot what the new census number is, something like that. I think it's like 390 million Americans. I don't know how many people worldwide. How many people in the world? 5 billion, something like that?
7 billion.
7 billion, okay. 7 billion people. We got to get how many vaccinated before we get herd immunity and this vaccine starts to die off because there's nobody to infect and there's no host to support it? How many we got to get vaccinated, Dr. Trinh?
At a minimum, we need at least 70% of the population to have some type of immunity to COVID-19. And immunity could mean that you've gotten immunity from the vaccine, or you've gotten immunity from getting infected itself, right, from COVID-19 and survived. But that combined, we need to get to a minimum of at least 70% to reach herd immunity.
And at that point, what happens? Explain to everybody again. We're all using the term. I'm not sure we understand. Like a herd of buffalo or something. If enough of us have got it, there's nowhere for the bug to go, and it starts to die off. Why does it need new hosts? Why can't it just stay in my body and keep me sick? Eventually, I either build an immunity to it or I die or something. It doesn't.
It's a battle, right? Once the virus gets inside you, the fight starts. It's a battle, and there's just going to be one winner. You are the virus.
Yeah, right. So, but I'm trying to break this down a little bit so I can understand it if nobody else can. All right, so the virus is in me. We're battling away, and one of us wins. I build an immunity to it. What happens to the bug? Does the bug die then, or does
the bug dies? If you win and you build the immunity, the bug dies, and so you are now immune to that variant, right, of the bug.
But the bugs want to jump from person to person, so that's on a little droplet. I spray, say something, and it floats into the air and floats up your nose, and now Dr. Trin's infected too. But so if the bug dies in me and it dies in enough people, is it just there are no bugs to sprout anymore here?
There's no bug sprouts. That's right. Bugs cannot go anywhere else. So the point of herd immunity is that if 70% of the people around you already have some type of immunity, then the bug has nowhere to jump to next. Right. For the bug to survive, it needs to spread. And so if most of the folks around you are immune, then it has nowhere else to go. So it just dies. But if the majority of the folks around you are not immune, then that's how this pandemic spreads.
All right. So here's my fear. This is what I'm trying to get to and see if anybody else in the audience shares this fear. So we're told that up to 25, 30% of Americans ain't going to get it for whatever reason. It ain't that big of a deal. It's been overblown. I don't need the darn vaccine. Or the opposite. Yeah, it's big, but I'm not taking that vaccine. It's scary. I'm going to get sick. I don't trust any vaccines, much less one that's been rushed in a year here. Whatever your reason, from left to right, right to left, there's a bunch of people who ain't going to take it. Or the community you're going to talk about can't get it, don't understand it, don't have access to it. They don't speak English, whatever it is. They're not sure where to go, how to go, all this kind of, there's this uncertainty. So that's the population you're focusing on today with, you're not trying to convert new people. You're trying to reach down deeper into the population of people who, for whatever reason, I'm here illegally. I don't know that I want anybody to know I even exist. I'm not sure where to go and what to do because I can't speak the language very well. Talk to that group, Vietnamese, Hispanic, other ethnic groups that are here in Orange County in large numbers have not been vaccinated very well yet. Talk about that group. Let's get, how about Terry in here? Let's bring Terry in. Talk about that population of people. How do you get them? And how are you going after them?
I'm sorry. I was doing something. Which
Oh,
population?
Terry, you got to pay attention here. We're gonna all right.
I'm so
It's a
sorry.
test at the end,
I can answer for Terry.
Okay,
Right.
I'm sorry. I'm sorry.
So obviously for us, like underserved community holds very near and dear to our hearts. Like, I mean, with Dr. Trinh, myself and Terry, I came from Vietnam. So with Dr. Trinh and then Terry with the Philippines, like we all immigrated here. So
Right.
underserved community is definitely our top priority for us here at the clinic. So one of our strategy is how we're going to go to these underserved community is that we're going to do some type of mobile clinics where we will have a mobile van that will reach these hard to hit areas. A lot of times we're talking about what you said is that they don't have any type of transportation. There's a language barrier. There's a lot of concerns as to how do they put their information on the registration? Are they going to get, pinpointer? All of those concerns come out. So that's what our team wants to do, is to kind of mitigate and answer to those concerns. So the first is transportation. So if we drive our mobile van into these clinics, we're right there in the heart of their neighborhoods to be able to help them. Registrations, we have, our teams come with different backgrounds and different languages, so we can help with that in terms of language barriers. And a lot of times these patients don't also have access to the internet to help to register. So our teams will be able to help to register. So these are the different strategies and ways that we are looking to mitigate for these patients and these populations.
All right, so let's dive into that a little bit here, and then we'll bring Dr. Trinh back in to answer some more questions. But I just want to understand this. So roughly, I have no idea, how many Vietnamese are there in? I know this is the largest diaspora. There's a fancy word. The largest expat community outside of Vietnam, I think, is Houston, San Jose, and Orange County. I don't know in what order, but there's a large number of Vietnamese. You only have to go to Little Saigon and Garden Grove, Westminster to know that. Is that population resistant, hard to reach? And I'll go one step further, because we've had people on in previous shows, not this show, but other shows, that say, these communities still live apart from us. They haven't, for whatever reason, language and acceptance and whatever, been brought into the mainstream in many ways. So they still carry things that they bring with them from these other countries. Like, I don't trust the government. I don't trust police. I'm not going to talk to anybody. We had a police, was either Anaheim or one of those, a police chief on one. So he said, we can't recruit people. We'd love to get more Vietnamese police officers. We can't recruit them because in their country, the police are all corrupt and crooked. No self-respecting Vietnamese would be a cop. So how do you get them to get past these barriers, these things in their own head? Not just the obstacles, I don't have transportation and I don't understand and I can't get on the internet, all big reasons. But are they resistant as a community to getting vaccinated? What do you think, Dr. Trinh?
There is, and we actually have the data, guys, on the number or percentage of vaccinations in ethnic minorities. So if you're comparing, Caucasian Americans,
right,
with other ethnic Americans, looking at the Hispanic community, where we have a penetration of vaccination somewhere between 10 to 20% only.
Wow, 10 to 20%.
Oh yeah, looking at the Asian community, very similar, low penetration of vaccinations compared to, maybe 50% of Caucasian Americans. The Black community is even worse; they're less than 10%. Wow.
So what is holding? So I guess what I'm trying to wrap my head around, and it's probably all of the above. Is it simply access? They don't have as many places to go. Is it simply understanding? They're not as mainstreamed into the media and everything else, so they don't know where to go or how to go or whatever, something here. Or is it transportation? Hey, I know all about it. I just can't get there. I'm working 12 jobs, 12 hours a day, and I'm taking buses and other sorts of things. Or is it what I'm getting at? There's something about these communities. They just don't want to listen and do this because of some fear, some bias. I can come up with 100 fears. I'm Hispanic, and maybe I'm not here with fully legal, or I don't trust the government, because where I came from in Guatemala or in Vietnam, the government is horrible and the cops are going to bribe you. And what is it, Chelsea, you think that's holding this back? Is it all of the above, or is there something we should focus on?
I think I agree with you, is all of the above. You can't really like pinpoint and say one is more prevalent over the other. I think it's all of the above in regards to different populations have different hesitancies and different barriers around how they can get access to vaccines.
So when you go into these neighborhoods, are they receptive, or are they like, I'm not going over there, I'm still don't trust it?
So, I mean, for us, what we are also trying to do is partnerships with local communities and local organizations within the community. So for example, if you want to target the Hispanics, we're going to start talking to Latino Health Access so that they can help us with the partnership, because a lot of times those communities are more, susceptible and more ready to listen to, someone of, their communities.
Right.
So that's what we're trying to do.
If I ran down to a Hispanic community, African-American community, Vietnamese community, old white guy that I am, and said, hey, you got to take this, would they go, not listening to you, buddy? Or would they welcome it and say, oh, thank God you're here. I've been looking for my vaccine forever here.
What's been amazing is that you can show someone as much data as you can on safety and on this and that. And it sometimes just kind of goes over like this, but right. They'll ask their neighbor or their friend or a friend that they trust, hey, what do you think about this? Do you trust that? And they go, yeah, I trust that. I've already got my shot. Okay, done deal. I trust him. I trust him. I trust her. So I'm going to get my shot.
Interesting. That's probably very true for all of us, but especially if you're uncertain or whatever. Hey, what do you think, Joe? What do you think, Sally? What do you think, my uncle, my grandmother? So do you have to reach influencers in these communities, people that the community trusts and knows, names that if they say it's okay? That's what you're trying to do with celebrities to a certain extent. I don't know if that still works like it used to. There are celebrities in the African-American community because for whatever reason, I still don't quite grasp, that community is resistant to get vaccinated. Not just, see, we have a tendency on the outside to think, outside these communities, think, it's just that they don't know. It's just that they can't get there. It's just that they don't have it. But surely when we arrive, they will all flock to get this, and that may not be the case.
And I think another point to our advantage is that a lot of our testing sites that we're doing for COVID testing are in these underserved communities. So hopefully with the patient being able to see that our name, like, hey, I came here for my COVID test and I had pretty good service and they were pretty trustworthy with my information. Maybe, same with vaccination. So that's what we're also hoping.
Well, it's all about building trust. And you're coming in from the outside because these are insular communities. They exist within our greater community, but you go in there and it's pretty clear that it's still a world apart from the rest of Orange County here. And that's where misinformation, fear, hesitancy can get into. So it's not just because the term underserved, and I don't want to start a controversy here, but I guess I will a little bit. It's frustrating looking into these communities, any of them, because we call them underserved. Well, then let's overserve them. Let's just bring them more service. That alone is not the answer. It's part of the answer, but not the full answer, right, Dr. Trinh? Or am I overstating?
How do you reach that community, right? Communities that are insulated. For example, Little Saigon. Right. Little Saigon can survive as Little Saigon without ever going to Irvine. Right. Or going up to Los Angeles.
Self-contained unit, right.
And you can live in Little Saigon all your life and never have to speak English, because everywhere around you, is a community that's built up, around the Vietnamese population. And in Orange County, there's over 100,000 Vietnamese, the largest demographic population of Vietnamese outside of Vietnam. Right. And we can say the same with other ethnic backgrounds. So how do we
Persians, Philippines, Hispanics, obviously, there's a handful, there's more than one. There's several large ethnic groups within Orange County that still live in a some of them still live in a pretty insular, self-contained area.
So I don't think by addressing one issue, you're going to address the entire issue of you know of that ethnic minorities issue. I think it crosses multiple domains, from social economic background to level of education to health equity. I think they're all connected.
How about fear or trust?
Fear.
I've got two things working again. Dan Daly says education is key. I accept that, but I still question it. Is education all it takes? I just got to give you a pamphlet of Vietnamese or in Farsi or whatever, and I get it now. I just couldn't read it before. Now I can read it. Or is it, you can hand it to me all day long. I don't trust you. You're from the outside. What do you think? What do you think, Chelsea?
Yes, but I think what we were talking about goes a long way. Besides education, is also by word of mouth or referrals or family. That is also, I know in my family, that goes a long way. It is like, hey, my parents have that barrier, and if my aunt says it's okay, then it's okay.
Now you have different family structures in these communities. The parents
yes.
are trusted. In my world, I'm a parent. I must say to my kid, "You got to do this." They go, "I don't have to, Dad. What do you know? You're an old." There's not that sort of reverence for the wisdom of age here. What do you think, Terry? You're Philippine, I understand here. So
yes.
what's it like in the Philippine community?
No, so I think 360 Clinic, since over here we're also a multicultural group. We're Vietnamese, Filipino, Chinese, and all that. I think it helps when we talk to these, patients, like, because we're here in the United States, and they're like, "Hey, you're Filipino," so it's kind of like, and if that person doesn't have family, it helps when there's another Filipino, that patient's talking to. So I think that also helps encourage those people, to get vaccinated.
So is there a level? I guess I'll go back to Dr. Trinh or maybe Chelsea here. Where do you start? Do you start just getting in there and talking to them? It sounds like that's what you guys are doing. And then at some point you got to build trust, and they got to start trusting you. And then at some point in time, the word starts to spread. Hey, this isn't so bad. Nobody died. These people are. Nobody went to jail. Nothing bad happened if I went and saw these people. Is that kind of the progression? Get in, gain a trust, get others, influencers in the community to come forward and get vaccinated, and then people start to believe and follow.
One of the advantages I think that our organization have is that we are a minority owned group.
You look like them. You're part of them. You speak their language. They understand. It's not me coming in telling you what to do, and you're like, I don't know, the last 10 times you came into my community and told me what to do, I didn't believe you. I didn't like you, and it didn't turn out too well. So I'm not sure I believe you guys, but
yeah, 360 is primarily, a lot of us are actually minorities, and we live in the community. We have Filipinos, Vietnamese, Koreans, Hispanics, and so we're primarily a minority organization, physician-led, that has a heart to reach out to our own communities who are not getting that access.
And here's an insight for everybody if they haven't realized it yet. Orange County is a majority minority community. The majority of people in this county don't look like me anymore here. So even though I might be the largest minority, every group in Orange County is a minority. There is no majority anymore here. Less than half of the county is Caucasian. And so it's a mixture of all sorts of ethnic groups, which I think is what's exciting about it and wonderful and points the way to the future. This is what America is supposed to be, the melting pot. At least that's what I was brought up to believe. And so within that, we all have to find ways to reach our tribe, our community, and convey this message to them. How is that? How about media? Are you advertising? Are you in, there's Vietnamese radio, there's Hispanic radio, there's other sorts of ways to reach these communities. There's even, I think, Arab TV and some other things here. How about that? Are you guys using the media to get your message in?
Yes. Social media is definitely,
Social
this day
media.
and age, everyone's best friend, right? In regards to getting the word out there. So with social media, our marketing team, we're also infiltrated into the little communities. I know that like sometimes with Facebook, there's like Vietnamese of Orange County, or, within the different communities, they have their own little Facebook page or Instagram page or whatever it is. So we're also in regards to those pages and then those communities within Facebook and all over social media.
So how we doing, Terry? And when we get into the Philippine community, let's talk about that one specifically. I know nothing about the size, nor I'm not even sure where the Philippine community is concentrated in Orange County, but I know there's a big one here.
Oh, there's a big one in South Bay. We do have a city called Carson. So that's the biggest town in South Bay. To get the word out, usually we do have if we're trying to target seniors for Filipinos, which is a major percentage here. We do newspapers. They do have Instagram and Facebook. So, and we do have a Filipino channel actually.
Right.
But yeah, over here as well.
So how you doing? What when you go in there, are they hesitant? Are they resistant? Or are they welcoming? Thank goodness you're here.
Okay, so actually they're very welcoming. Most Filipinos are actually nurses. They're all in the healthcare
There's
field.
a huge number of Philippine nurses. Somebody's got to explain that to me someday. But everywhere I go, they're all Philippine. And it's like, I guess if one group gets into something and then they bring everybody along with them or something. All right.
Yes, so it's true. Most of the Filipinos are healthcare workers. So it's not really on Filipino groups. It's not really hard to convince them because we have a big family and they trust us. And so like even Kaiser are 80% nurses of Filipinos.
80% of the nurses at
Really?
Kaiser. If I went up to Irvine to the big Kaiser hospital there, I walked around 80%, like 3/4 of them are Philippine nurses.
Are Filipinos. Yeah, they are.
Well, then they
Especially
get it.
in
They're
South
nurses.
Bay.
Yeah. How about the Vietnamese community, Chelsea? When you walk in, same question. Do they run and hide? Do they peer out at you and say, I'm not sure I trust you yet? Or are they like throw the doors open and say, hallelujah, you're here?
For us in the Vietnamese community, anybody is very receptive when it comes to any healthcare workers. They'll listen to you from beginning to end. I'm pretty sure Dr. Trinh can attest to that with his patients.
Well, I was on Vietnamese TV not too long ago, Little Saigon TV, and unfortunately, I needed a translator myself.
Dr. Trinh, come on.
So bad. It's like saying Nguyen, right? Oh my word. So I felt like a really bad Vietnamese. So anyway, but hopefully they understood me.
Is it, and I suspect this is true with all ethnic communities, is it harder to get the first generation who still struggle with the language or still hold on to the traditions or live isolated in the community? So it get easier when you get to the second and the third generation, they get more assimilated, more into the melting pot, more mainstreamed. Is it easier to reach the younger than it is the older?
First generation's always hardest. We find out that the first generation, no matter what ethnic group you are at, our older generation, right, our parents, our grandparents,
right,
those are the folks who can't just go on a Othina website to sign up for anything because of the language barrier, the IT technology barrier, right, and those are the folks who need the most help. We find that when we go to a community like maybe an apartment building that has either a lot of Vietnamese living in there or Mexicans living in there, the older folks want the vaccine. They don't know where to go. Right. They can't just browse the web because 1, they don't have a computer, 2, they don't know how to navigate it, and 3, English is not their language.
Right.
So we have to come out to them.
So let's talk about one other group that you're probably not driving into, but I just read a report. I was shocked. One of the other groups that's seriously under-vaccinated is my tribe. Old white guys that live in affluent neighborhoods here who have, for some reason, up and down the coast, we're not reaching a large population of older white people. I'm going to guess because they're probably more conservative and doubted this was a big deal, they're tough. I talk to that group. I mean, there's another, I don't know why they're underserved. It's not because they don't have access and can't find it and can't get it. They're just not reacting to it. What is that true? And if that's true, what does that say? You got a whole nother group that should be easy to reach and is resisting the reach.
So that's a trust problem. That's not a problem with the lack of access to vaccines or the lack of access to technology or money. It's a problem with trust in the vaccine itself.
Right.
And
Or the need for the vaccine or
need
whatever.
for the vaccine. And
so let's ask your audience here. We got a bunch of a whole wide range of Orange County sample or people around the country. Let's start with that. Is trust still an issue? Trust whether this is overblown. Trust whether even if it isn't overblown, this is the answer and this is going to work and I'm not going to get sick. Do you trust the need for the vaccine, and do you trust the vaccine? Answer, if you will. Give us some ideas. Your audience out there listening, do you? And then we'll get to Robert's question. I'm sorry we overlooked it about can you still get sick and stuff. We'll get to that in a second here. But I just want to wrap my head around, are we just fighting access like we were in the beginning? Everybody wants it, but not everybody can get it. Or are we fighting fear and trust still? Answer, if you will. What do you think, Terry? Does the communities you walk into trust this? Not just trust you, but do they trust the need, or are they still afraid?
I think it's both. It just depends on the culture and education. I think elderly people who wants it doesn't have access to it, and the ones who there's also a percentage where they don't trust the vaccine still.
Still
So
don't trust it.
I think it's both.
What do you think, Chelsea? You're going to walk into a Vietnamese community. What's the first question you have? Is this safe, or what's the trust? Are they trusting what you can do with the data? Are they trusting I don't know if I need this. I don't know if this is safe. I don't know if I want to get it from you because I don't know what you're going to do with the data. Where's the trust problem?
I think the barrier with what we're talking about trust is more of the second part, which is, am I going to get sick, or what's going to happen to me? Especially since this vaccine's only been established a year ago, there's not enough data to show what can happen down the future. I think that's more of the trust barrier and the trust issue.
Well, I'm with Dan Daly. If you don't trust it, okay, but so what's the alternative? Nothing is perfect. You're just gonna roll the dice and see if you get sick. But that seems to be kind of a male logical point of view. Okay, well, show me something better and I'll take it. But until then, I'm taking this. Right, Dr. Trinh?
And there are still people asking a question of, is there a tracker that's being embedded into the vaccine where the government tracks you?
Yeah.
And
honest to God, that people think this is just a trick. The government is implanting something in there and they're going to track you. That any government vaccine program is really there to turn us into Big Brother here.
Those questions are still being asked, and what can you do?
Except say no. Where did you get such a ridiculous idea? No.
But there are news medias and certain news outlets out there that feed that type of
because they live on fear. They feed on fear. If you're afraid, you keep watching. If you're safe, you turn it off.
But what boggles my mind is that why is there such a huge mistrust with COVID vaccines? What about all the other vaccines that's been here long and gone, like the flu vaccines, pneumonia, shingles, all those other vaccines? Why isn't there the same level of mistrust versus with the COVID vaccine? Yeah.
And do we have the same urgency? I am going to confess, I'm in some ways the target population too. I'm not sure I trust any doctor. I'm not sure I really going to take any drug if I don't have to. And for years, I never took the flu vaccine. And I got the flu every year. I don't know why that was better, but I'm not taking the flu vaccine. Even my wife didn't want to take it. Somehow it's a live piece of flu. That doesn't sound bad, even though it wasn't, but that's what I thought. It's a real, they're putting the bug in my body. That doesn't sound good. I don't like that. Is it just our hesitancy to believe doctors? And we don't trust doctors, Dr. Trinh. Why don't we trust doctors?
Because they don't like my digital exam.
Oh my God.
Oh, that's it.
Telemedicine, you know, I don't know yeah, but
So what about telemedicine? Let's pivot into that. Is that everybody? Dr. Trinh touts it all the time. Telemedicine. You can go see anybody right now. You don't have to get in your car, make an appointment, sit there for a half an hour, be in a room with a bunch of sick people. All that sounds great. I'm just going to get on and talk to Chelsea. Chelsea, I'm scared. I'm worried. I'm wondering. Is that helping, or is that just I'm still afraid?
I think that's helping. For me, telehealth, telemedicine is the future of medicine. You
It
know,
is.
going to doctor's offices, meeting, what you're talking about is a thing of the past. Like, you don't have to do that. You can just be in the comfort of your own home. You're scheduled for 12 o'clock. You show up at 12 o'clock, you know? And I think with telemedicine, it makes healthcare providers more easily accessible for patients. So if patient wants to book an appointment same day, they're able to do that. And they are able to talk to the provider and ask any questions or concerns that they have.
How much of your time is still spent in those telemedicine calls, like what we're trying to do every week here, answering those questions, solving those fears, creating trust? It's okay. It's okay. No, it's not scary. No, they're not putting something in your arm. No, you're not going to die. You know, how much of this telemedicine is just hand holding and making a nation of little frightened children feel safe again here?
I would say a lot, especially with our clinic. We do most of our telemedicine outreach to patients that are either COVID positive or they come in with symptoms that show negative. So a lot of time is to have patient education around getting vaccinated or having their families vaccinated after their symptoms, you know, get better.
So are we going to get there, Dr. Trinh? Are we going to get to herd immunity, or are we going to hit a wall and this thing's going to continue to rage in a segment of our population?
Based on the numbers that I'm looking at, even in the states that a few weeks ago we are seeing higher numbers, like Michigan,
where I came from, yeah,
several East Coast states, right? The numbers are starting to look better, so there's hope. I think the faster we vaccinate, the faster we can beat this bug.
And let's talk about the speed of that, because nobody talks about this much, but here's my fear. Now, maybe I'm just spreading more false fears here. See if anybody else out there has the same fear I have. If we don't get to herd immunity, this bug is going to morph into something deadlier. It's going to turn, as it continues to evolve, as it continues to change. If we let it keep infecting people and percolating in the society, it will turn potentially into something much deadlier. And now we all got to go back and get vaccinated again because the old vaccine doesn't work anymore.
We're working on boosters now.
Yeah, I mean, is that a real fear? The longer we let this bug continue to evolve, to continue to get stronger, better, do things, the quicker we extinguish it, the less likely it will turn into something worse. Is that true?
That's absolutely true. If you look at believe it or not, I think the largest strain that is being that we're seeing now in the United States is the England B117 strain that is growing. That strain, that variant, right? Variant/strain, right, is the fastest growing strain in many countries right now, simply because this mutation have allowed it to be more contagious and grow at a faster rate than the original strain. And that's what we're fighting against, because there may be another strain being developed right now that's even faster than this current strain, right? And it's a
strain that goes, I read about in Michigan, where I'm originally from, that they're seeing for a long time. The beauty of this one, as opposed to the one in 1920 that hit, this doesn't hit young people. In 1920, it hit young people a lot. This variant's just old people. And so, you know, that's even more frightening, that your kids could get this thing. Right now, that hasn't been the case, and kids are pretty immune to this, it seems like, if I'm correct in my understanding here. But this new variants, or some of them, are attacking kids and younger. Yeah.
Younger people are being hospitalized. Part of that could be the fact that we've dedicated our vaccinations toward our older generation first, right? Our older folks first. And so,
All right, let's answer some questions here, Doc. Let's go to the one that's first one off. We're deep into this world of how do you get everybody vaccinated? Can we do it? Particularly ethnic communities don't understand, can't get there, don't trust, don't speak the language, all that stuff. That's what you guys are targeting. I applaud you. Get in there. Everybody's got to get this thing if we're going to get rid of it, in my opinion. But let's talk about some of the questions here as it brews around. What was Robert's question? Go back up and read Robert's question at the beginning here, Dr. Trinh. Robert Lanez. I think he said, do you see it there? He wants to know, can you clear something up?
Yeah. Robert's question is, once you get vaccinated, can you still spread the virus? Is the vaccine supposed to prevent you from getting it? Or
so the bug's still in me, but I got this barrier that will keep me from getting sick. But every time I breathe, I'm still spitting out the bug to somebody else.
The real life data that we have collected shows that if you are vaccinated, the data we have shows that there's about a 90% chance of reducing transmission from you to another person.
Oh, okay.
So not only won't you get sick, you won't be spreading it to anyone else.
So if you don't think you need it, think of your neighbor, think of your family, think of your friends.
Yes.
Do them a favor and don't. You may think the bug is no big deal. It's the flu. I don't care. I'll ride it out. I'm not worried about it. But it's not just you. You're sending that bug to everybody else who are rightly or wrongly frightened of getting sick, who are afraid of dying. So if you care about anybody other than yourself, don't get vaccinated for you. Forget it. Get vaccinated for them.
Yes. Dan Daly says, what percentage of the population gets the annual flu shot? I would say less than 50%.
Yeah, I never did. This was the first year I ever got the flu shot. How foolish. Why?
Yeah.
I don't know, some little childhood fear of needles or getting sick from the vaccine. It's putting the real flu in you. Aren't I going to get sick? And I don't know. I don't need it. I don't worry about it. But
and what's interesting is that the flu shot, its effectiveness is nothing close to the effectiveness of our current COVID vaccination.
Right.
The flu shot's effectiveness, in a good year, you may hit, 50, 60% the effectiveness. And here you get a vaccine that has been shown through Pfizer, through Moderna to be, 90+ percent effective. And then there's fear around that. And it's very interesting. And Chelsea's absolutely correct. Over the last 10 years, we have approved many vaccines, right? We got the shingles,
smallpox, whatever. Yeah, right.
No, we got all these different vaccines, pneumovax, pneumonia. And this is the one vaccine that out of the others, right? This is the one vaccine that's been targeted as,
don't need it, don't want it, don't trust it, get it out of my face here, not going to do it. And so you're selfishly, you're saying, I don't want something in my body because I don't believe I need it. I don't believe I trust it. I'm not sure I'm not going to get sick from it. I'll wait. But it's not, you're not just then affecting yourself. You then become a carrier for two things. One, to give it to somebody else because the bug's in you, whether you want to believe it or not, you're spreading it. And two, you're letting the bug continue to evolve. Everybody it affects, it comes out a little different and it starts to get more resistant to drugs and stronger. And, the strong survive and the weak die off, and the stronger variations start to emerge. The ones that get kids sick, the ones that are harder to wipe out. And if we that's what happened to the flu. The flu is so many different variations now. You can't kill the flu because there's so many bazillion variations of this drug. It changes so quickly, this disease, that you can't just target it and zap it. So do we want this? This isn't the flu, but do we want it to be like the flu where every year it's just hanging around and evolving and we got to stay ahead of it constantly with new things? And this is just the new normal. We're going to be sick and masked up for the rest of our life because we all can't get together and kill this thing? I'm sorry to be on a soapbox, but it's so frustrating to me. If you don't want it, great. Don't take it for you. Take it for me because I don't want the bug to live. I don't know why we can't just patriotically, compassionately all just do this and get it over with. Sorry, that shut everybody up here. Wow.
What are your thoughts, Chelsea?
What
Well,
do you think,
I
Chelsea?
think COVID is going to pan out like the flu, where every year there's going to be new variants that will
Yeah.
require for everybody to get booster shot. That's my personal opinion of how it's going to turn out. And maybe in probably a couple of years, patients or the community can be like, okay, well, I got it the first time. Nothing really happened to me. So I'm going to trust it that it'll be able to protect me second or third time around.
Right.
And more people are going to be more open to getting vaccinated.
I hope so. Well, out there in your audience, how many of you have been vaccinated? Who hasn't been vaccinated and why? If you would, we're not going to shame you. I'm not going to shout at you, but I just really am frustrated. I don't understand why. I get in the beginning because we didn't have one, and then I got for a long time because you couldn't get it. It's limited, but we're past that. It's in CVS pharmacy, for Pete's sake. You can go to any CVS or Walgreens in America, I think, now and get it. If you can't get it, these people will come to you. If you don't understand how to do it, they'll speak your language. They'll come into your community. They'll go anywhere and everywhere. There's an effort to eradicate this thing. And why is anybody resisting this thing? I don't understand. I would like to understand, because I don't. I really don't. Anybody want to come be brave enough and tell me why they haven't been vaccinated? Give me some stories. What do you hear when people say no? Why?
I have a personal story.
Okay.
Okay. Actually, my sister, she just recently been vaccinated because she says she's just scared. Even though, I keep telling her she needs to get vaccinated, plainly she's scared of the side effects of what, one of other researchers, have been telling the news, just basically side effects and less data of this vaccine.
My sister-in-law won't get vaccinated, but she's I'll say a very left-wing vegan activist, and for her, you don't put anything in your body, period. End of story.
Right.
Everything you put in your body's bad if it's not from a plant, and so just ain't gonna do it. No vaccine ever, never, never for anything. And I'm like, I'm back to Dan Daly. Then what? What's the alternative? I can't eat a healthier life and avoid getting sick. I can't live in isolation. I can't exercise and make myself strong. But there are people who think I'm going to make my body immune the natural way. I'm going to be tougher, stronger, eat better, run faster, stay away from it. Is that true, Dr. Trinh? Can I just make myself healthy and hard
I mean, you should be doing that anyway, right? With or without COVID. To boost your immune systems, improve your lifestyle, to lower your inflammation levels, things of that sort. So without a doubt, we recommend all those lifestyle activities.
Have there been any confirmed deaths due to the vaccine? Robert wants to know.
Yes, so there's two things people should know. We have vaccinated over 100 million Americans.
It's
right?
pretty high. We were up to 1 million or 2 million a day.
We've vaccinated over 100 million Americans, and so in these 100 million Americans that we've vaccinated, we're all going to have our heart attacks, our cancers, our car accidents, our deaths. The question is, are we tying these events to the vaccine itself?
Right.
Or is this stuff that's going to happen with or without the vaccine?
And how would you know? How would I know? You're a researcher.
So, Robert, to answer your question, to answer Robert's questions, if there is somebody who died after being, vaccinated, we should look and evaluate all that. We have enough data now. There's over 100 million Americans vaccinated. We should look to see if there's a link, if there's a tie to it, or if it's just an association because so many people's been vaccinated that statistically something's going to happen to somebody, right? And
now we pulled AstraZeneca because there was a small percentage of people that were developing blood clots. Was it among women?
We've never approved AstraZeneca. It's never been approved for FDA vaccination. It was approved in Europe, and it was evaluated in Europe. They held the vaccine for a bit to evaluate the blood clots, right, that have occurred with AstraZeneca and the same thing, right, with J&J. We had a brief pause to evaluate for these blood clots. Both J&J and AstraZeneca vaccines are now given the green light in Europe. The World Health Organization evaluated the number of patients who had blood clots with AstraZeneca, and what they did is they compared those who had the vaccine had blood clots, and then they compared with a group just in the population who never had the vaccine and had these blood clots. And lo and behold, there wasn't much of a difference between the two numbers. And what that tells us is that our process of monitoring for these side effects is very sensitive, very accurate, and it works.
But how do you answer Robert's question? I mean, he really nailed it here. Thank you. Thank you for jumping in here, Robert. He basically saying there's so many experts on so many different channels, left, right, and center, who all claim to know, and we're just another one of those voices in the wilderness trying to say, here's the facts, and then 5 minutes later, somebody else will say, that's not the facts, here's the facts, and then somebody else says, no, you're all wrong, this is a government conspiracy. That's a fact. And we all then end up shrugging our heads and saying, I don't know, I'm not a researcher, so we go on our gut. We go on what feels good. Terry's sister, even though she knows probably better, feels unsafe. I don't feel the need to do this. I'm afraid. So we're going off of feelings and not facts. How do we get out of a feeling world and into a... Dr. Trinh lives in a fact world. Show me the facts, I'll make a decision. The majority of people are just doing it on feelings.
100%. I see that, Robert. You can throw anybody with an MD on a YouTube channel and they can promote any wacky stuff they want, right? And
as a fact,
as a fact, right? There's the Flat Earth Society.
Flat Earth Society,
right? The Flat Earth Society exists, right? There's a society that believes in UFOs that land every few years.
Wait a minute, I'm not sure. I might be one of those. Go ahead. All right.
Right? So all that wacky stuff exists. The way that I sort that out is I look at research, I look at clinical trials, I look at double-blinded clinical trials, and I sort out the actual data from the testimonies, right? From the testimonies. And I've told this many
stories.
times.
We all listen to stories. I say it all the time on this channel. Don't give me the facts. Tell me a story, because the story you'll believe. The story of Terry's sister is so true to me. She's a nurse, and her sister says, I don't know if I still trust it, though. Come on. I know you say I got to do it, but I don't really trust this. Come on. I'm scared. I'm afraid. I'm something here. The stories are what make us wait. You said the doctor comes in the community and says, here's the facts and here's the pamphlet. And then they look to their grandmother and say, what do you think? Like grandmother knows.
Right. They look at that. And there are, unfortunately, news media outlets from both the left and the right that has a purpose and that has a propaganda behind it, and they feed whatever story to feed their audience.
My
right?
sister-in-law's a member of the left-wing contingent of the world, and to her, all vaccines are evil. All of them are bad.
And the right wing's the same.
And the right wing, and the right wing says just what Julie says. I mean, there are literally people that agree with Julie. I thank you for coming forward. She says, I know of a family member that believes as a fact that there is some conspiracy behind this, and somehow, don't tell me this isn't a way for the government to control you, to know what you're doing, to track you. That's what this is all about. It's a trick to stick this tracking device in your arm here. Yeah, and then it's not, Robert says religious groups. I'm sure there are. I haven't read of any, but they're saying that it's not a godly thing, that this is, I certainly know people, I don't want to out them, but I know personal people Not me, but I know people who I think are really smart otherwise. In fact, some of them are show hosts on OC Talk Radio, come in and privately tell me, this is not at all. This was never a big deal. 500,000 people didn't die. This is a lie. They died of something else and they just stuck COVID on the death certificate. This is nothing like that. This is all just some trick to scare us or control us or do something here. I mean, people believe that as a fact.
Yes, it's and yet these same religious folks are willing to take their pneumonia vaccination, their shingles vaccination, you know, their chickenpox vaccination. It's just COVID's evil. But
or they're willing to handle snakes. You go back to some of those cults in the Christian cults where they have to handle serpents to prove, because God said somewhere in the Bible that he won't let you die, and if you believe. And I mean, come on, this isn't
the one virus that has been so politicized.
Unbelievably.
Unfortunate. Too many
really
deaths
is.
have occurred because of this religious and political.
Dr. Fauci just came out and blasted, I think it was Jim Jordan or somebody like that, one of the members of the right-wing world, and he said, this has been overblown and we no need to vaccinate everybody. And he was just like, come on, 500,000 people died. This was an emergency. But there are people that still question those numbers, that still don't believe. Dr. Trinh, you just put that on the death certificate. He didn't die of COVID. You just did it because you get $1,000 extra if you put COVID on there. Is that true? Do you get more money if somebody dies of COVID than if they die of something else? I don't know. I've heard that.
I haven't gotten an extra.
You didn't get an extra $1,000 here, so there's no incentive.
No bonus, no COVID bonus, no COVID death bonus.
So, because I'm sorry, our last president was touting that. Oh, that's all you're doing it because you get more money if somebody dies of COVID than if they die of a heart attack. So put COVID on everything. COVID. They were going to die anyway. You just put COVID on there just to skew the numbers here. We are in a real trust problem. That's what I'm hearing here. We do not trust anybody. And so we don't trust the media. We don't trust the doctors. The people we do trust don't know. I'll give you one last story and we'll end with this. So years ago, I'm not a big gambler, but years ago I went with a friend of mine who was a big gambler. We went to the track, horse racing. And so I watched him. I said, oh, he knew all the charts and he knew how to pick the horse. I'm just saying, I don't know, that one looks pretty. I'll pick the, no, there's a science to this. And I said, okay, show me the science. The science is he goes over and asks these bums, these track bums, all right, you were here this morning. Who ran faster? What do you know? And the guy says, yeah, it's Lucky Dan in the third here. And I got the inside scoop. The fix is in. It's Lucky Dan in the third. I'm like, if this guy's so knowledgeable, why is he a bum? Why is he dressed like a bum over here and every day in the truck? Why do you trust this nomad, this truck over anything else? And it never worked out ever. Lucky Dan never did come in third, but we trust. We have these lucky superstitions. We have these crazy people we listen to, and we treat them like shamans. They know. Dr. Trinh doesn't know. Chelsea doesn't know. Terry doesn't know. But that guy on YouTube, he knows. He knows. Why do we trust such strange, crazy people and not our own experience and not our own selves and not our own? That's what you guys are saying. Once they get through the real experience of it, then they're going to say, that wasn't so bad. Nobody's tracking me. Not true.
Yes. Crazy times.
Crazy times. All right. Well, but I'm glad that you're out there fighting this. How do they reach you if they want to learn more, if they want to access your programs, if they want to find out where you're going to be? Chelsea, tell us how you're win, lose, or draw. You're going back into these communities and you're saying, come on, we're here. Don't listen. Do it. Let's do it.
So they can go to our website, visit our website at 360clinic.md, or they can just follow us on social media, either Facebook or Instagram, 360 Clinic. And then if you want to make appointments, that's where we will flash our daily, whatever sites we have open at what time, and then you can go and make an appointment for your vaccines.
All right. And I doubt we have any Vietnamese listening, but give us it in Vietnamese. Tell us a little thing in Vietnamase here, the same thing. For the four Vietnamese
that's definitely putting me
listeners.
on the spot.
Come on.
Great. Come on, Chelsea. In
Let's
your
go.
Huế accent.
In my Huế accent. Chelsea muốn chúc mọi người đi chích hết cả nghe.
Okay, that's it. And does Terry speak? What's the
Tagalog.
Tagalog?
How do you?
How do you say it in Tagalog or Tagalog or however you say
in
it?
Tagalog?
Yeah.
Okay. So, hello mga kababayan, get your vaccine at 360 Clinic.
Wow, there's two hesitant ethnic appeals there.
Okay, we're not that great of representatives. We can barely speak the language. But
All right,
Barely.
We have a vaccination tomorrow?
Yes,
Right?
yes. Tomorrow we will have a site at Fountain Valley Sports Park, which is in Miles Square Park, and it's open for appointments. You can make your appointments on My Turn, or just go to our website or go to our Instagram or Facebook page, and then they'll tell you how to go ahead and make an appointment.
All right, you all did it in your native languages. Now I'm going to do it in my native language. Are you ready? I'm going to make my appeal. Dude, what do you think? Dude, what's the problem? Eh. Duh. That's my native language. All right. The Simpsons. All right. So thank you for coming on today here. And I hope you'll come back and give us an update as you're out there in the community. Is it working? Are we getting through to people? And if not, what do we got to do to bang their heads and make them wake up and stop listening to the YouTube shamans and the crazies and start doing this, if not for themselves, for everybody else, really. Come back again and give us some updates, will you?
Yeah, thank you so much for having us today.
Okay. Take us out, Dr. Trinh.
All right, guys, go get your shot.
That's it. That's
yeah.
Okay, now you know why we tune in each and every week, right here on Orange County's only community radio station for Health Talks with Dr. Trinh.